will this eventually start working? Is that even a possibility to see if there's just simply not enough people enrolled?
Yeah, so Elizabeth used the phrase smooth a transition, which is what HHS Secretary Kathleen Sebelius said yesterday in explaining this rule change. But the reality is that there's going to be a massive disruption in the market for individually purchased insurance as a result of this change. I wrote about it for Forbes today, describing it as utter chaos, which is what it will do, because as many as 6 million people will now be exempted from the individual mandate, people who had previous coverage, and the administration now agrees the new coverage under the Affordable Care Act is going to be, quote, unaffordable, unquote, and that's why they're not going to be they're going to be exempted from this individual mandate. It's going to be a hardship exemption. But the thing is, the uninsured who also can't afford these new high premiums are not going to be exempted. So it strikes me as odd that people with previous coverage are going to be exempted from the individual mandate, but people who were uninsured before will not be exempted.
So, and what do you make of that contradiction, Elizabeth? Because we expect the president is going to have to tackle that in some way in the press conference at 2 p.m. How do you explain that?
I can't disagree with what Avik said, and I also can't explain what the president may or may not say this afternoon. What I can say is that there's no question that there is going to be some confusion and disruption, but we have to kind of take a step back and recognize why we did this in the first place.
What's your timeline on that, Elizabeth, though? When you talk about disruption, and we've heard that a lot, from all sides, quite frankly. Consumers may be asking, when? Now we're almost at the end of the year. So when do the disruptions stop? Are we talking about several years down the line? How patient do we have to be?
No, I don't think it's going to be several years down the line, but there's no question that January and February are going to have some bumps in the road. And it will be interesting to see, to kind of go back to the enrollment point, how enrollment does pick up. Our analysis at Avalier shows that actually when Medicare Part D started, that 2/3 of folks who signed up voluntarily did so after January 1st. So we're certainly behind where we were with Part D, but should a similar pattern kind of come forth, we will see an uptick in enrollment. And when we get everyone in the system, hopefully some of these bumps in the road will smooth out.
Let me ask Avik about that, because we have seen that in certain states like California and New York. They're reporting that there are more people coming into the exchanges now. And some suggest, once everybody gets past the holidays and can actually focus on what's going on in 2014, we are going to see the people come. Do you expect that?
Yeah, I think the pace of enrollments will increase. That's typically what we see. But the real issue here is not the number of people who enroll, it's the mix of people enroll. Is it older versus younger people? Is it healthy people versus sick people? And all the indications we have today is that it's mostly sicker people and older people who are enrolling in the exchanges, which means that the plans will be a lot more expensive in the following year, and it means the insurance companies may lose money on the plans that they offer in these exchanges.
And if they do lose money, if they don't get the enrollment, then they're owed subsidies as well, which launches us into another conversation completely. This is a big bill, and there's certainly a lot to talk about. Elizabeth, Avik, great to have you both. Thank you very much.
Sure thing.
Thank
Merry
you.
Christmas.